Local Women Magazine presents Local Women Podcast, the show for things that matter.
Hi and welcome to Local Women Health Podcast. My name's Emma Heaney and today I'm joined by Dr Dean St Mart. He is a pharmacologist and also the co-owner of Supplement Needs. Welcome, Dr Dean.
Thanks a million, Emma. I'm very pleased to have been invited down to speak on Local Women's Podcast.
Thank you. I think it's really important today that we want to look at women's health. And could you just maybe introduce and give the listeners an overview of your really vast and wide career so far?
So I guess my background qualifications is I have a double honours degree in chemistry and pharmaceutical chemistry, so in pharmacology and drug design. And then I moved into synthetic chemistry. And from there, I guess my interest in bodybuilding, health and fitness sort of started to change my dynamic away from why we create some medicines like we've spoken about before and that we're just looking at resolving symptoms. And I became more interested in naturopathy and functional medicine and asking the questions of if someone has a problem or a disease, what is the root cause to that problem, as opposed to here's a medication to get rid of your symptom and yet the disease or the problem just continues to manifest under the surface. So that led me into the fascinating world of dietary supplementation, herbal medicine, looking at really, I guess, biochemistry, and if there's a problem in the body, your internal biochemistry is trying to tell you there's a problem and how can you address it. So 6 years ago, I joined Supplement Needs with my friend Lee, and we just set about creating a holistic supplementation brand that would basically, from my ethos, protect your future health. And I guess I was sort of projected into the forefront of educating the younger generation of like fitness athletes, whether males or females, trying to make them understand that, you know, some of the choices that we make, even the food choices, what impact they'll have later in their life, and maybe look at perhaps what you're lacking from a nutrition perspective, because at the end of the day, dietary supplementation is exactly what it says, to supplement your diet.
And your flagship product, I think, was Sleepstack, is that correct?
Sleepstack was the very first product. So when I left the university setting, I became a chemical engineer and I was working rotating shift patterns. And that again was sort of where I started to ask the questions around functional medicine towards sleep. You join a company, they give you some brief induction on how to sleep during night shift, but a lot of it to me just didn't make sense. It seemed quite backwards. So I became very interested in the biochemistry of how you fall asleep, how you stay asleep. And it really, at its most complex outlook, sleep is actually very simple. When you break it down, to fall asleep, you have to have low dopamine, you have to be less stimulated. You have to have more serotonin to feel content or to be relaxed to get asleep. And then once you're asleep, it's your body's production of melatonin. People have heard melatonin as a supplement, but it's actually your body creates its own melatonin during sleep that keeps you asleep. And when you look at the core, I guess, vitamins, minerals, amino acids or protein molecules that contribute to sleep, you're really looking at raising your serotonin with tryptophan or 5-HTP. You're looking at converting that with vitamin B6. And then once you've created that high serotonin from the 5-HTP or tryptophan, you're trying to make that serotonin become melatonin. So this is where a lot of people think melatonin as a supplement will help me sleep. How melatonin is metabolized by your bodies very quickly. So it helps you fall asleep, and then you stay asleep maybe for 2 or 3 hours, and then it's cleared by your body, and all of a sudden you're wide awake at 1 or 2 in the morning. Mm-hmm. What's important is getting that serotonin to melatonin, which is through a very important enzyme that uses vitamin B5. So I had that like aha moment when you look at how it all plays out in very complex biochemistry of it's really 6 simple nutrients that you're taking to support your dietary needs, to put it that way. And it was night and day difference. I mean, for the first year of working night shifts, you're trying to combat between, I guess, getting adequate sleep and rest during the day, and then having to go into quite a stressful environment of what my career was and make critical decisions quite quickly. And then on top of that, you know, being an athlete, a bodybuilder, and trying to balance training with night shift sleep. Once I unlocked, you could say, that simple biochemistry, the combination of what's in the Sleepstack, the 5-HTP, L-theanine, which is in tea, an amino acid that calms your brain, zinc, magnesium, vitamin B5, vitamin B6, 6 very simple ingredients, no sedatives, nothing that would make you feel drowsy. And my sleep, I could go to bed at either 9 p.m. or 9 a.m. and sleep straight through to 4:30 a.m. or 4:30 p.m. It didn't matter what side of the day I was sleeping. Playing into that simple biochemistry was quite profound. And then from there, I brought the idea to leave, obviously for supplement needs. And that's where just, I guess, catapulted us out into the industry, and we've not looked back since.
Yeah, from a lady that's awake since 4 o'clock this morning. That'll be first on my shopping list, I'll tell you. So when we go on from sleep, I suppose a lot of our listeners are of a certain age. We talk a lot about the menopause. So maybe if we delve into supplements and the menopause to start with.
Yeah.
I know you and I joked one day, and I said that when you're scrolling at 4 o'clock in the morning when you can't sleep, you'll buy every supplement that says, oh, that helps you do this, that gets rid of the hot flushes. So it's like, how do we get the right supplements for us? I know it's not, you can't one size fits all, but a rough guide, because I have bought so many over the last couple of years thinking, please help.
Yeah. I mean, that was one of my, I guess, principal ethics with supplement needs, was that we'd never make a product that wasn't backed by some level of clinical research, where it was animals, humans, in vivo studies. That you find a lot of companies will create products and build them on hype, and then they'll create what are called proprietary blends. So when I see this dirty word, as I put it, you don't really know what you're getting, and the consumer doesn't know otherwise.
No,
but it's a very sneaky way that you can make a label claim on a dietary supplement that it does something based on one of the ingredients. With a proprietary blend, you basically create like a sleep matrix or a fancy name, and you put all your ingredients underneath that blend. And by, I guess, nutrition law or food law, you can basically put 1 milligram of that ingredient into the product and make a claim that it's in your product, when, let's say, the research says you need 1,000 milligrams. And so when I started educating people online about what other companies were doing, that proprietary blends do serve towards intellectual property. If you know a secret and you don't want to tell someone how much of a certain ingredient you've used to protect your intelligence, then that's where it's supposed to be used, not to create a very cheap product and hype it through marketing. So when we're looking at what is best to select, for example, multivitamins or B vitamins. B vitamins are normally the main one that we can have a discussion over. That a B vitamin can be quite a cheap supplement, and people might not eat their leafy green veg or a wide variety of fruits and vegetables, and may be slightly deficient in certain B vitamins. The problem with some supplements is that they will use the most basic format of the B vitamin that your body basically just excretes. So if we look at B complex and it has vitamin B6 or pyridoxine, a lot of cheaper blends will use pyridoxine hydrochloride or pyridoxine HCl. You'll see this on the label. And whilst that is vitamin B6, your body has to do a very important conversion called phosphorylation. So you have to create this active form of vitamin B6 for your body to use. So if you're taking pyridoxine HCl, you're relying on your body doing this reaction. Mm-hmm. To me, it didn't make sense that why would you do that when pyridoxine 5-phosphate or P5P, you might see this on a product, isn't put into the ingredient in the first place, so that you're bypassing this conversion process of the body. And as most people know, if B vitamins aren't used by your body, you excrete them out in your urine. Mm-hmm. So taking a cheaper product, really you're just wasting money. You're flushing it down the toilet was how I used to joke about. But
technically you are.
Yeah, if you're not giving the body the source of this active form, and again, phosphorylation requires other nutrients to play into it, that when you're looking at even minerals, how the mineral is chelated, how the mineral can get absorbed into your body is very important. And the key one that we often look at from a supplementation perspective is magnesium.
Yeah. There's a lot of talk around magnesium at the minute.
And, quite rightfully so, in that most people are deficient in magnesium. Looking at the recommended daily intake of magnesium, it's reported around 300 to 400 milligrams. That is relatively easy to get from your diet with some intelligent nutrition. But the way I always explain it is chocolate would be a big source of magnesium. So again, if you crave chocolate, it's often a sign that you're looking for magnesium to your body. But on the other side, from a vegetable perspective, a whole bag of spinach, like 200 grams, only has 80 to 90 milligrams of magnesium. And if you need 300 to 400 as your normal baseline, it's a lot of fruits and vegetables that people might not be getting daily. And then you have to look at the impact of cortisol and stress. And there's a fantastic published paper of cortisol and magnesium, the vicious cycle. And basically, the more you get stressed, the more adrenaline you produce, the more cortisol you produce, and then you use magnesium to calm that cortisol and adrenal response. So you're getting more and more depleted in magnesium, and you're getting more and more stressed, and it just becomes this vicious cycle. That when we look at what the research recommended intake of magnesium is, it's around 10 milligrams per kilogram body weight.
Right.
So now you have maybe a 60 or 70 kilo female who needs nearly double what the recommended daily intake is. Again, it's just a baseline. And magnesium, critically important, especially for females. One, magnesium is very important for energy creation. We often focus on B vitamins for energy creation, but magnesium is very important for your glucose metabolism. So as you get older, you might have risks towards type 2 diabetes. Magnesium is very important to help insulin do its job, and also for your cells to take glucose inside. The little energy powerhouses, the mitochondria that make your ATP energy, they use a lot of magnesium as well. So if we're feeling very tired, run down, quite often we reach for B vitamins, it could be magnesium deficiency. Magnesium also is very important for metabolizing estrogen and dopamine. So again, if we're in a very highly stimulated environment or stimulated brain, we need magnesium for the enzyme that clears both estrogen and dopamine. So it's interesting that the two of them go through the same enzyme to get broken down. That if we have a woman who has very high estrogen, they might feel very anxious. And again, it's because that enzyme that uses a lot of magnesium just isn't getting enough to do its job properly. And when we look at today's society, between stress, between high anxiety, quite often we come back to nutrient deficiency of magnesium. So the most important, I guess, thing to look at when we're assessing what mineral to take or what form is what's attached to that mineral. So you couldn't just take magnesium in raw form. You wouldn't absorb it from your gut. In the beginning, there was a very cheap form of magnesium available, magnesium oxide, which when we look at these chelates, it's the percentage of magnesium that's within the product. So magnesium oxide has quite a high percentage of magnesium, in that it's around 50%. But when you take it, again, people view it as a laxative or it causes their bowels to run. What's actually happening there is you're absorbing that magnesium into your gut. It's hydrating your gut and your gut is flushing. It's not that it's a bad form, it's just being incorrectly absorbed in the wrong place. And that's when we look at amino acid chelates like magnesium biglycinate, which is what a lot of people see for sleep. And that's basically a magnesium attached to two glycine amino acids. On one side, it is only 10% magnesium. So this is often quite funny when you ask someone, do you take magnesium as a supplement? and they'll reply, yeah, I take 2 capsules of magnesium before bed, or magnesium bisglycinate. And then you actually tell them, well, that's only around maybe 140, 150 milligrams of magnesium you're getting, and your recommended intake is like 600, 700, or even 800 milligrams. That 2 capsules might not be playing into what you actually require. But magnesium bisglycinate, because it has the 2 glycines, can be absorbed by your gut. So once it reaches your gut, the 2 glycines can bring the magnesium across into your bloodstream. Glycine is a very important amino acid to calm your brain. So you have a glycine pathway in your brain that calms it down. And then the magnesium obviously is being delivered to all these enzymes, whether that's to get rid of estrogen, to get rid of dopamine, to improve your energy metabolism. It's one of the most gentle forms of magnesium, and that very rarely will it cause problems unless you take a huge amount in one go and your body can't really absorb it properly.
So any of the ladies that are listening, I know you do private consultations, isn't that correct?
Yeah.
So they can get in touch, and I wanted to ask you more about
Of course, yeah.
the menopause, because I know there's a few lists of other topics that they want to talk about. Just want to stay where you talked about the cortisone cycle. Lots of the questions that came in were asked Dr. Dean about the cortisone belly that everybody just automatically seems to just get.
Yeah.
It's like you've stepped into this rubber ring. Why?
So visceral fat accumulation around our abdomen
This is usually perimenopause, menopausal age.
it would, and that's more so to our insulin sensitivity.
Right.
So what we'll find is as we get older, our hormone production declines, both males and females. Obviously with males, their hormone production stays between the brain and the testicles, whereas in a woman's, as we approach perimenopause and menopause, there's a switch from the ovaries being the primary hormone center to the adrenals. So throughout a woman's reproductive cycle, they're going to be making about 50 to 75% of their hormones from the ovaries. And as they enter into later life, there's then a swap where the brain and ovary connection becomes a little dysfunctional. And then there's a signal sent to the ovaries to basically keep trying to make hormones, and they can't really. And that's why as we reach menopause, you see that LH and FSH and bloods go higher and higher, because the brain is basically trying to tell the ovaries to make hormones, that the adrenals then take over the majority of that hormone production. But now you're asking, I guess, the adrenals to make progesterone, cortisol, testosterone or androstenedione, the precursor to your testosterone, and DHEA, and then obviously create some level of estrone and estradiol, your female hormones. And that's a big ask on that one single pair of glands above your kidneys to take over the job of something that was producing a lot of your hormones for most of your reproductive life. So when we have that visceral fat accumulating around the abdomen, it's normally a sign of insulin resistance or insulin sensitivity issues. And that can come from, I guess, we go back to a nutrient problem with magnesium. So the mitochondria that make your energy are what burn glucose for us. So we often hyper focus on this sort of no carbs in the evening and looking at, trying to control insulin, eat a low insulin diet and everything else like that. That insulin is basically like the key for a lock. So you put insulin into the insulin receptor on your cells. You're putting this key into the lock and you turn it. And now you open the door to let glucose go inside your cell. But once the glucose is inside your cell, it has to undergo reactions to create your energy. So as you get older, I guess the other things that play into that insulin sensitivity are your testosterone and estrogen hormones and your thyroid hormone. That whilst that fat accumulation is linked to insulin resistance and high cortisol or high stress, the other root causes that are playing in the background are unbalanced testosterone, whether it's too low or too high, unbalanced estrogen, and then obviously that inappropriate cortisol response as you get older again from stress and your body trying to manage internal inflammation as well. That even if we were to optimize that insulin function, there's a whole host of other things that then play into how you use that glucose inside your cells. And that's where a lot of people will then think, okay, well, I'll go on a low carbohydrate diet, which serves a purpose in the short term. So it might help improve how you bring glucose into your cells. It might help improve that insulin sensitivity. Again, with blood work, what they track is how much glucose goes onto your red blood cells over time. And it's called HbA1c. And that's what they track for type 2 diabetes as a marker of developing. That if, for example, we remove carbohydrates from dietary nutrition, we still have to make up the energy balance in order to get our daily energy intake, that people might start shifting over to fat. But then dietary fat, depending on the type, your internal metabolism of how you digest and break down fat, can go two ways. It can either improve how your cells use insulin, or the increase in fat can actually make your insulin sensitivity worse. Because if you've got too much fat in our bloodstream, if you don't have the right way of utilizing that fat for energy, it will actually interfere with how your insulin is working on your cells. So you can sort of see that, like how I became fascinated in this sort of area of health, is that it's not just one system that's failed on you. No. There's about 4 or 5 different things that are feeding into the one problem. That when we look at how perhaps conventional medicine approaches a problem like insulin resistance, the immediate thing is, okay, we give a medication like metformin, improve how your liver can use glucose, improve your insulin sensitivity. You might then be told about reducing carbohydrate intake, improving your exercise. But underneath the surface, you could have low thyroid hormone, or you could have low estrogen, or you could have low testosterone. And they're all feeding into the picture of your insulin sensitivity, rather than just that simple blanket advice of the pancreas working by itself for your insulin and your cells becoming resistant.
And I know that we just touched there on testosterone, which has a massive impact on muscle, isn't that right?
Correct.
And also on libido as well for the menopausal or perimenopausal lady as well. And it's not something that's prescribed on the NHS here, but it is available privately. Isn't that correct?
Yeah. I mean, looking at testosterone, this is probably one of the most common hormone deficiencies in aging women, in that the body, the adrenal gland has to make a decision on how do I balance between enough progesterone, enough estrogen, enough testosterone. That when you look at the reference ranges for perimenopause into menopause on testosterone production, it's quite often argued that if a woman presents herself with low testosterone on her blood work, that's a normal thing.
Yes.
But the woman could have strength deficiency issues, or again, issues with bone mineral metabolism, so the risk of osteoporosis, which is important towards estrogen, but testosterone helps with your growth hormone. And again, growth hormone is helping with cellular repair. That it's probably the one hormone in women that is very inter-individual. So there's no strict, like what I find fascinating with women's endocrinology is it's like no one standard dose fits all. Whereas when you look at testosterone replacement therapy in a male, there is one set standard dose from the British Society of Sexual Medicine of a male should take this dose to get this amount of testosterone. And then they sort of move from that point. Whereas with a woman, there's quite a lot of things that play into it, that too much testosterone in a woman, like polycystic ovarian syndrome, PCOS, will cause metabolic problems like insulin resistance or blood sugar issues.
Excessive hair growth.
Excessive hirsutism, the follicle growth then impacting onto their fertility cycle. Too much estrogen, which knocks out their capacity to ovulate. That with testosterone prescription in females, it really is probably one of the ones where it is a trial and see of giving a very small standard dose, which quite often is a transdermal cream.
Yeah.
And then you can progress through, depending on the response with the transdermal cream, to patches or pellets, sub-Q pellets that are administered every 3 to 4 months. But again, with stuff like pellets for women, it's a very unpredictable response in that you have this depot of hormone being injected and you're waiting for it to release at, it can vary in terms of the rate of release. Whereas if you're using a cream, was the cream, a pea-sized amount of a cream would be like 1 gram of cream. And within that, you might have 1 to 2% testosterone. It's a little more controlled in terms of what you're applying, but it still can vary depending on where you place the cream. So the absorption rate depends on where you put it. Again, in the thigh, in the armpits, on the neck, the skin, the thickness of the skin will influence how that cream is absorbed into the body. That again, stuff like that has to play into consideration of trialing different places on the body, different times of the day. But there is no strict guidance when it comes to women of what exactly is the correct dose to use. And quite often when women consult with me, this is where I'll try and partner with a female endocrinologist, because you can have a discussion about a standard dose of what we think would be where to begin, but it could be completely wrong for that person's biochemistry. Yeah. And that's why it's important then when women go down this route that first and foremost they look at bioidentical hormones. So there was I wouldn't say fear mongering, but the misinformation spread about HRT with women and increased breast cancer risk, that when we actually look at what that research relied around, it was synthetic estrogens and synthetic progestins. That really, from a biochemistry perspective, you want to use female bioidentical hormone replacement, or BHRT, which is very important when you're looking at female hormone health and a HRT clinic, that this is the road that they're taking you down, as opposed to the synthetic hormones, which do have some level of risk with them.
Yeah, I think they all both have a certain level of risk, but I mean the research you're talking about was a long time ago and it was quite dated.
Yeah.
When we look at the more advancements in sort of conventional medicine now as well, I would definitely agree. I personally take bioidentical. I'm quite happy to discuss that as well, and it's made a massive change to me. But we could talk about menopause. I could talk about it all day with you. The cortisone belly. It's each one's individual. I'm going to have to go back and answer this question for these ladies.
Yeah.
It's
really, on one side, the very root cause to think about is insulin resistance.
Right.
So look at your nutrition very first and foremost. But then you also have to look at that cortisol response. And in today's world, every one of us is easily accessible within a click of a finger with a mobile phone, building in habits and routines around your sleep. Again, sleep is where we help to lower dopamine, lower cortisol. So at night time, your cortisol is at its lowest, and in the morning time, it's at its highest. We have to look at, what's feeding into that overproduction of cortisol. Is it chronic adrenal fatigue, if you want to call it that, where you're basically relying on quite a lot of caffeine to get your adrenals responding? It could be something as simple as exercise again, where you're exercising, but the underlying nutrition playing into the exercise, again, is where we need to address to ultimately figure out that root cause. And then from there, ask those broader questions of what hormones might be suffering in the scheme of it. But again, nutrition, carbohydrates, like I said, you can lower them to an extent, go to so low carb diet, but eventually you might run into problems where the little powerhouses that make your energy, the mitochondria, they require glucose in quite a high amount in order to work properly, that you start making them less efficient, and then your body gets stressed as a consequence of them not being able to keep up with energy demand. You see, it just becomes this whole vicious picture overall.
It's a vicious circle.
Yeah.
So if any of our listeners want to get in touch with you, what's the best way to get in touch with you to discuss that or book a consultation? So
my email's on my Instagram handle, deanstm@hotmail.com. Normally we sit down, I'll receive everything from the person ahead of the call, see what I can see before I even consult with them. I'm the type of person that I'd rather, if I'm going to have a consult with someone, that I know what road to go down, as opposed to let's figure out as we go along. And then if I don't know the answer, I've got some very good friends around me that I can refer to.
Well, thank you very much. I have a few questions. I must make sure that I've covered them all. Can vitamins really help for hormonal acne or mood swings during my cycle? That was a question I got.
Oh, that's an amazing question. So with acne, again, if we look at the conventional solution is normally hygiene or being bactericidal, kill P. acnes, which is the bacteria that causes acne on our skin from sebum. But if we go a step below that, we have to figure out then, well, why is our skin producing more sebum? Why are we producing more oil, which can lead to comedones or clogged pores of the skin, and then it develop into the classic pimples or whiteheads? Could it be that we have too much testosterone, making DHT, the metabolite of testosterone, which is more androgenic? And that will create bigger skin pores, that now you've got a bigger hole that the sebum can block, and now you get your blackhead into a whitehead. Is it estrogen? Because estrogen as well has an impact on your sebum production. And quite often you'll see potential hormone patterns between like androgenic acne and then estrogenic acne. So stuff that's caused by testosterone tends to be more so around the face, the neck area, whereas estrogenic acne, or where we have estrogen potentially as the root cause, is normally around the upper back, the shoulder region. When we look at estrogen then of itself, this again is where blood work is amazing, because you look at your estrogen, you look at your testosterone and your bloods, but that is how much of that hormone is inside your blood and not inside your cells. So you could have a normal estrogen biomarker on your blood. Your doctor looks at it and says, oh, your estrogen's in range. But you make estrogen inside your cells, and if it doesn't take effect, it leaves the cell into your bloodstream. So you could have very high estrogen being made inside your skin cells, or DHT from your testosterone inside your skin cell, and that's influencing the amount of sebum you're making, that you might not see this on blood work. That one of the best functional tests I often suggest for hormonal acne is what's called the dry urinary test for comprehensive hormones, or DUTCH, DUTCH. And what that does is it collects 4 to 5 urine samples across a 24-hour period, and then it maps your hormone metabolism over that day period. So whilst your blood work might show that your estradiol is normal, you then do the DUTCH test over a 24-hour period, and you actually see that the estradiol is extremely high over that 24-hour production. And then from estradiol, you have 4 other metabolites of estrogen that you can't just focus on estradiol. You have to focus on how the estradiol is metabolized to estrone, which is E1, and then estrone has 3 other metabolites from it, a 2, a 4, and a 16 hydroxyestrone. And whilst that's complicated, really how your body gets rid of them is through methylation, which is an enzyme that relies on magnesium. So we come back to, again, magnesium.
Come back to magnesium.
Magnesium is very important for methylating estrogen. So is your methyl donors, so your methionine and SAMe. Again, these are things that you can either supplement, so you take your methionine from protein, or SAMe is a direct form of S-adenosyl methionine that your body makes, that you help that enzyme then to push that estrogen out. And what you might find is between magnesium deficiency, folate or vitamin B9 and vitamin B12 deficiency, that your clearance of that estrogen out of the body is not how it should be. You also have glutathione, which is your liver's main antioxidant. That's really important for clearing one of the metabolites of estrogen out as well. And if you're, in an environment with high pollution, or you're not eating enough sulfur-rich protein sources to get cysteine, and again, it's where people take N-acetylcysteine as a supplement for glutathione, that estrogen can get stuck in your body, to speak. You also have a certain type of bacteria in your gut that makes an enzyme that can basically cause your body to recycle estrogen back into your body again as you're getting ready to excrete it out. That when I see stuff like hormonal acne, I start to think about estrogen overloads, or we're not getting rid of the estrogen properly out of body. Or there might be that genetics of the high DHT, but that's normally with those who would have high testosterone, like PCOS. And supporting it would be your magnesium, folate, B12, glutathione. Food triggers, when we look at what can also increase the pore size of the skin, it's insulin growth factor 1, IGF-1. And this is where for a long time there was, I wouldn't say like old wives' tales, but surrounding like dairy triggering off acne. There is research that shows that milk proteins increase the amount of IGF-1 you can make, and then that IGF-1 causes your skin pores to get bigger, and obviously then from that point clogged and head into the acne setting. That it's fascinating when you look at what drives acne formation. It's not just, on the surface, it's dealing with hygiene, trying to get rid of the excess sebum, trying to make sure the bacteria doesn't grow in your skin, whether that is with ultraviolet light exposure, laser therapy. But again, that's really like surface level, where you're just trying to keep the problem at bay, when the internal biochemistry, the hormone metabolism, the food choices could be what's the internal driver. That I often say your skin is one of the biggest indicators of what's going on inside your body, because when you view what your skin actually is, it's your largest detox organ of your body.
Yeah. Thank you so much. That's a really, really good answer. I could talk to you for hours. I know we're going to talk about GLP-1s, but we're going to do that on our aesthetic podcast, because there's loads of questions about weight loss. But for now, thank you so much. You'll probably be inundated with questions on your Instagram this evening. So if you want any more contact with Dr. Dean, go on to his Instagram page. And thank you very much.
Thanks a million, Emma, for inviting me.
Local Women Magazine presents Local Women Podcast, the show for things that matter.